We're pleased to kick off the second hour of this edition of the MegaCast with Molly Macdonald. She is the founder of the Pink Fund and joins us once again on the MegaCast. Molly, thanks for being with us.
Thank you for having me.
Appreciate having you on. So for those that are unfamiliar, maybe this is the first time they've heard of the Pink Fund. They haven't watched our previous interview with you about the Pink Fund. Tell us a little bit about the organization and what it does to help people in our community.
So basically, the Pink Fund is an organization that works in the space known as financial toxicity. If you think of toxicity as a financial burden when someone is undergoing cancer treatment, many women and some men in treatment for breast cancer are unable to work and they lose their working income. And often that will cause them not to adhere to their treatment protocol, which affects their long-term survival. So at the Pink Fund, we step in and provide up to 90 days of non-medical financial aid by making payments to their creditors for housing, transportation, utilities, and insurance. And by removing that burden from them, they're able to focus on their treatment. And that provides them with one less thing to worry about.
Of course, Breast Cancer Awareness Month is oncoming, and the Pink Fund is kicking off Breast Cancer Awareness Month on Friday, October 1st, with Dancing for Survivors. It's a dance party at Campus Martius Park in downtown Detroit. Molly, tell us a little bit about this event, and how it was organized, and what people can expect if and when they do attend that event on October 1st.
So we're inviting the public to come down free of charge to Campus Martius from 11 to 1 p.m. on Friday, October 1st for a dance party. Ben Sharkey and his septet will be performing a number of Motown tunes, and we also have a DJ, Invisible, who will perform a series of various songs that people can just come out and dance and celebrate. You know, we've all been kind of held in our homes and not able to get out in public as much as we'd like, and so we wanted to kick off Breast Cancer Awareness Month with dancing. Also, Fred Astaire Dance Studios and their professional dancers will be performing. And dance has been proven to boost everybody's mood. You listen to the music, you move your feet, you have to concentrate. It's just really a celebration to begin the month. Nationally, we'll be working with dance studios and others who want to raise money through dancing, either by putting together TikTok videos, and just to raise awareness that while in active treatment, many individuals lose their income and are unable to work, and then that, as I said earlier, affects their ability to adhere to their treatment protocol.
We're joined by Molly Macdonald. She is the founder of the Pink Fund with us on the MegaCast. And so you mentioned part of the reason why you hold an event like this right now, trying to bring people back together in some way or some form, give people a fun outlet to express themselves, to communicate with other people after the isolation of the past year and a half. Now that it's a little bit safer than it was a year and a half ago to do something like this. But what else was the motivator behind this? Why a dance event, and why right now?
So we used to have Dancing with the Survivors, and that was an in-person event, and we can't do that anymore. So we just really wanted to invite the public to come down, as I said earlier, at no cost to them, to celebrate and dance and just have fun. I mean, breast cancer is a very serious disease, but it has a high rate of survivorship. We thought also there'll be some other of our partners down there, Ford Warriors in Pink, Shirts Brewery, a few others will be down there talking about the work that we do and the work that Ford does to support our program. The money from Ford that they donate through their Warriors in Pink program goes to support transportation payments solely. And apart from that, since we can't hold our nice event, our in-person event, we wanted to really just make people aware that this is a big problem for cancer patients and what the Pink Fund is doing to address it.
And how has fundraising been during the pandemic? Because in many ways, people were more strapped for cash during the last year and a half than they were before, and then they maybe are right now because of job losses or because of other extenuating circumstances, or trying to just save up in case things got any worse than they were at one point or another. Did that impact fundraising efforts for the Pink Fund, and then how would that, if that did impact it, impact the services provided?
So actually, we expected a 30% drop in revenue. We did not experience that at all. We've seen a lot of individuals and for-profit companies pivot towards our mission because we are essential to people completing their cancer treatment. without interruption. And so we have met our budgetary goals for 2020, and we're on target for 2021. And in fact, this year we expect to make $1 million in bill payments, whereas last year I think we were at about 780,000 in bill payments. So we've seen an increase, particularly in the corporate partnership world, where they may have been supporting other important cancer research organizations. Now they are pivoting to support the Pink Fund's mission.
We're joined by Molly Macdonald. She is the founder of the Pink Fund, joining us on the MegaCast. Learn more about the Pink Fund and its event coming up on October 1st, Dancing for Survivors at Campus Martius Park, by going to their website at thepinkfund.org. That is, again, thepinkfund.org. And Molly, you're the founder of this organization. What prompted you to lead an organization like this, to create an organization like this, to help so many people who have been affected by one of the many burdens of a bout with cancer?
So I was diagnosed with breast cancer at a time of job transition, which basically derailed my job opportunity and left me unemployed and unemployable for 6 months while I underwent treatment. And without my income and the addition of a $1,300 a month COBRA premium, our family experienced what is now called cancer-related financial toxicity. I couldn't make my house payment. I had been through a financially devastating divorce. I had no savings, no alimony, and very sporadic child support, and now no job. So within 3 months, our home was in foreclosure. And in 6 months, I'm standing in line at a church basement to help feed my children through a pantry, a Gleaner's Food Bank pantry. And while I was in active treatment, I met many other working women like myself who were on unpaid leaves, who had much more aggressive and longer term treatment protocols than I had. And they were thinking about stopping treatment, which is not a good idea, so they could go back to work. Would they have to sell their home? Should they dip into their retirement savings and pay the taxes on that? Do they bring their kids home from college? And so I met with the social worker where I was receiving treatment, and I asked if there was any organization that could pay a non-medical bill, and particularly for me, my COBRA premium. And she just looked at me with a blank stare. And so I thought, well, if I can't get help, maybe I'm supposed to give help. And that belief that I could do it fueled me, and my husband and I got started. And the first year was 2007 that we were able to give out grants, and we were giving out about $2,000 to $3,000 max a month in bill payments, whereas now we're doing $85,000 a month. So in 2012, we went from being a Michigan-only organization to a national organization with the help of Ford Warriors in Pink as a corporate partner. So that's how it got started. And interestingly enough, some of our funders have said, well, why aren't other people doing this for other types of disease states or other types of cancer? And I tell them, well, I'd be happy to let them R&D our program, which is rip off and duplicate it. But and I'm happy to give them some advice. And so there's a website called Givesly where you can sign up to have a 30-minute conversation with me by making a $100 donation to the Pink Fund. And then I will share all my knowledge with you so that you can start something similar if you so choose.
We're joined by Molly Macdonald. She is the founder of the Pink Fund, with us today on the MegaCast. Find more information at pinkfund.org, where you can learn more about all the work that the Pink Fund is doing. And they're doing amazing work. Since 2008 through 2020, 2,626 grants awarded, and just in the fiscal year of 2019 to 2020, $806,000 worth of financial aid was distributed to people dealing with cancer all across the U.S. It's not just a Michigan-based organization anymore, as Molly had said. And Molly, how critical is the work that the Pink Fund does to helping people survive cancer? Because in one way, they're surviving physically, where you either beat the cancer, it's in remission, or you're able to live with it to some extent because it's not deadly. But on the other hand, it's a financial burden that not a lot of people can live with because of the state of our healthcare system here in the U.S.
Well, the real issue is really when one cannot work because of the treatment protocol. So you physically, maybe emotionally, mentally, you cannot perform your job. And so without your income, then you go into financial free fall. So what we learned in a 2017 survey we conducted nationally is that 41% of patients did not adhere to their treatment protocol when they had to make a choice between a house or car payment or going to treatment. And patients are most concerned about their home going into foreclosure or evictions. And we know that those have been forestalled somewhat during COVID, that the government has helped out that way. But when people think that they might be homeless, then they will go back to work and they'll risk their health and their survivorship. So that's what we say at the Pink Fund is, while fighting for their lives, many people lose their livelihoods and face the potential for catastrophic financial losses. So that would include, as I mentioned earlier, foreclosure on a home, an eviction, a vehicle repossession, utility shutoffs, and then homelessness. And eventually, in the most egregious of cases, when people did not adhere to their treatment protocol, they are at risk for earlier mortality.
We're joined by Molly Macdonald. She is the founder of the Pink Fund, joining us today on the MegaCast. Learn more and donate at pinkfund.org. That, again, is pinkfund.org. And Molly, how do people go about receiving the grants, receiving the financial aid from the Pink Fund? What goes into that process? How much can people apply for? Does it vary case to case?
So the first step is when you go to our website, you click on Get Help. And there are 4 pre-qualifying questions that you must answer. One of them is your household income at or below 500% of the federal poverty level. And that chart is right on our website. Are you or your spouse or partner unable to work while you are in active treatment? So we've recently added in, it used to be that only the patient could demonstrate a lack of income, but now their spouse or domestic partner can show that they're unable to work. And that's primarily a result of COVID, with so many individuals unable to work or being furloughed from their jobs. So if one adult in the household, spouse or patient, loses their income, they're eligible. Then is their household income at or below 500% of the federal poverty level? Are they in active treatment, which for our purposes is mastectomy, chemotherapy, or radiation? Then they give us their email. We email them the application. The application is color-coded with icons to make it easier to understand for people who are more visual learners. And then there are some videos on the website that will teach them how to fill out each page of the 6-page application should they not understand exactly what to do. So then they mail in the application. Currently, we do everything by mail or email. And it's processed by a patient navigator to ensure that all the supporting documentation is in the file. And then it goes to a committee of diverse individuals who work in threes to review the application. The patient will submit the bills they want paid, copies of the bills, not the originals. And then the committee will decide for up to 3 months how many of those payments we're going to make. And then the next day, the patient is notified what payments are going to be made on their behalf. We include the name of the creditor, the account number, their name, the mailing address, and we ask them to confirm all that. And then those payments are made. We also have a fund for women with metastatic disease who are going to be in treatment the rest of their lives and are going on to Social Security disability. We'll make their payments for up to 6 months while they're in the wait period for SSD, where they cannot show any working income.
We're joined by Molly Macdonald. She is the founder of the Pink Fund, joining us today on the MegaCast. And Molly, the financial struggles of dealing with cancer go beyond the end of treatment. How long does the Pink Fund provide funds that would then be able to support these patients that are dealing with the financial struggles about with cancer?
So it's 3 months. And we call it a financial bridge. And then after that, we refer them to other organizations that might help them cobble together additional support. That's one of the struggles we have. We'd love to add a 4th, 5th, or 6th month onto our program, but we just don't have the funding to support that.
We're joined by Molly Macdonald, the founder of the Pink Fund. To learn more information, donate, and join them for their live programming on pinkfund.org. And Molly, over the pandemic, a lot of organizations began to go from having in-person events or doing a lot of in-person supports to switching to virtual. I see on your website that you've been holding virtual support over a Facebook Live series. Is that series still ongoing? And if so, what does it feature and how can it help people that may be dealing with financial struggles of dealing with cancer themselves or a loved one?
So a lot of that material on the Facebook Live is still relevant. We are not doing that again this month or in October, but it's around how do you optimize your insurance? It's around health literacy. How do you understand some of the terms that are thrown at you as a patient? Um, it's around support, where else to get support, and just how to manage that cancer journey. I do want to say that we recently conducted a study with the University of Michigan around financial toxicity and the gaps that patients identified. And one was at the beginning of treatment, they want clarity as possible on the expected costs and timeline of their treatment protocol so that they can plan financially. And we're going to start addressing some of these gaps that patients have actually identified. And then we'll be doing that through either a podcast or an Instagram Live or a Facebook Live in the coming months.
We're joined by Molly Macdonald. She is the founder of the Pink Fund with us today on the MegaCast. Molly, just a few more minutes with you before we'll say goodbye. Is there anything else that would be important for our audience to know, either for themselves or for their loved ones if they're dealing with the financial struggles of dealing with cancer, or more about your organization that would be interesting for us to know at this moment in time?
Well, I think the most important thing is we are going to be doing more outreach in the Michigan community in underserved areas, both in urban and rural areas, to try to give information to patients, the health navigators, the social workers, the discharge nurses, even the surgeons, who are the first ones to see the patient after they've received a positive diagnosis of breast cancer, to let them know of our service. Because we really want to be able to help more women here in Michigan in particular. And we do have restricted funding for Michigan. Some of our grantors want that funding restricted by state, and we honor that. And so as part of that, we're going to be doing a lot more in the community, probably through Zoom education, because we really can't be walking into hospitals right now and holding events. As you know, as you've said, all the in-person inside events are being canceled. So we're looking forward to addressing those gaps. I mean, I told you about they want clarity at the beginning of treatment. They want a discussion early on about how finances can affect their treatment. They don't know who to seek out in the healthcare system to find the resources, and then they don't know where to seek out community support. So we will be bumping up our website to be more robust in terms of where else can you go for support besides the Pink Fund. We want people to get the support that they need. It doesn't all just have to come from us. There are other organizations, both here in Michigan, that provide parts of some of the support that we do. Maybe they'll help a patient for 1 month. Maybe they'll provide a grocery card or a gas card. And the unfortunate thing is that the patient has to cobble together these multiple resources, going down lots of rabbit holes to find out what they need. And we're hoping to make that easier in the future by having maybe one portal on our website, one single application, and then that can be sent out to all the organizations that might be able to provide support for them.
Molly, we appreciate your time. Thank you for joining us and telling us all about what the Pink Fund is doing to help people who are dealing with cancer and families dealing with cancer right now all throughout Michigan and the U.S. And for telling us more about your event coming up on Friday, October 1st. That's 11 o'clock to 1 p.m. At the Campus Martius Park in downtown Detroit. We appreciate your time.
Yep, we want to turn Detroit pink, so come out.